used car every year. And of course, it all goes away. You have to buy it again. You don't do that with a used car, right? You buy it and then maybe you keep it for 4 years. With health insurance and the prices, you're paying $10 or $12,000 plus the deductible. So let's just say you have a $6,000 that you pay in premiums, but your deductible is $6,000. So what you know is that you're going to pay $12,000 before insurance even kicks in.
Yeah, exactly. And then you might have a 70-30 plan or something. So it might be up to 10 grand.
And you might only go to the doctor once and it costs you $300. No,
yeah.
See, none of that makes any sense. And the reason that when insurance first began, the reason it made sense was because it was a catastrophic policy. So it was a really high deductible like we're having today, but it was a really low, affordable premium. And then it wasn't managed care. So the insurance company didn't get involved in telling your doctor what to do, or didn't limit where you could go or who you could see or how many days you could be there. And so it was just a backstop for you financially if you really had a catastrophe, because so few people actually have catastrophes.
Which is what it's becoming now for a lot of people anyways, except they're still managing all the details of it. Because if you think about it, like for us, our family, as soon as you go to an HSA, you're essentially paying for all your own health care. And then unless you have a catastrophe, you're not even going to end up tapping into health insurance. So essentially that's what you're doing in most cases anyways, except you're paying a lot more for it.
That's right. I wrote an article about 2 years ago that Obamacare is a scam, because what it has done is it has allowed the health plans to charge us phenomenally expensive premiums for a product that should be affordable. Years and years ago, a lot of us had catastrophic major medical policies. They were very, very affordable. They did indeed have high deductibles, but because the insurers and others weren't involved in making our healthcare decisions, and there wasn't all of this sort of what I call mother may I medicine, where you're going up to the health plan and the insurer and trying to see whether or not you can get something covered, because all of that kind of stuff wasn't involved and it was just coverage for a catastrophe. It was truly affordable. But today we have policies that are not affordable, but they're catastrophic. And so that all of us, if we have a $6,000, we're paying $6,000 for a premium, for instance, or $12,000 for a premium. And then we have a deductible that's $6,000 or $12,000, right? What we end up paying and know that we're going to pay is $12,000 or $24,000 before insurance ever kicks in. And so we're really being ripped off.
It just seems ridiculous.
It is.
I mean, we can't justify it.
It's not even a indemnity catastrophic policy like it used to be, where you could go anywhere. You could go see any doctor. You could have any medication. They had, they basically had, this is what we pay for that sort of thing. Now go take the money and pay for it. And then everything was more affordable because everyone did not go through the insurance company, and
and doctors got paid more too, right? I mean, doctors got paid more. I mean, it wasn't,
that's right.
And they didn't have as many burdens put upon them. So there's this whole middle area, this whole overhead area that's just killing us.
That's right. It's killing us in our pocketbooks. And then if we're truly vulnerable and in a terrible situation health-wise, we might be arguing with the insurance company in order to try to get the care that we need. So it makes us extra vulnerable when we're truly sick and we don't have the reserves and the resources to have that kind of a fight. But then it also really discourages doctors. The morale amongst doctors is very low. And this is not what you want. You really want a doctor who cares about you and is loves their profession, but now they're being controlled from the outside.
I heard, my sister's a doctor and my other sister's a pharmacist, and, upon talking to them, I hear kind of amazing stories, but I hear that doctors are the number one profession that goes to seek mental health services because it's so stressful right now for them. And they don't feel that they can take care of their clients, their patients properly.
That's right. So they spent 11 to 15 years learning their profession, only to have, people who have a 4-year degree in business telling them what they can and cannot do. And they spent all this time and gave of their life in order to do something that meant something to them. You don't give up that much time because it's, isn't meaningful. And so they look at their patients across the exam table or at the bedside, and they're thinking about what the payer is going to say, what the hospital electronic health record is going to let them do. And they know what they want to do. And so it's like it's putting them in an ethical quandary, in a place where they shouldn't be. And they are becoming, through Obamacare, they're becoming rationers. That is what Obamacare is set up to do. It is set up to make the hospitals and the doctors those who ration care rather than the health plans, because of the payment structure that is put in place in Obamacare.
Well, I know the doctors are just getting so angry because there's some things that their patients need so they don't lose a limb, or I've heard some terrible stories where they haven't paid for things that patients need, and then there's a catastrophic result that occurs, and now it ends up costing a lot more money. It's awful.
Well, a lot more money. And then, of course, what about the life of the patient? Right?
Oh, yeah. I mean, that's the money is the side issue. It's the point is that they're going after it to save money, and then they're costing them more money. The real problem is the ethical issues with not taking care of the patient properly.
Right. And I think if I could have a moment to just describe here what Obamacare wants to do with the health plans and the doctors, to give everybody a bigger picture, because I don't think anybody really.
That's what I want to get into, like why the state exchanges, why we all have those, and what is their overall plan?
Well, I think here's what the plan is really, that the insurers will no longer be insurers. So just wrap your mind around that. So let's just say United Healthcare, Aetna, Kaiser, they don't really plan to be insurers at the end of the day, because Obamacare moves to something called accountable care organizations, ACOs, which are called HMOs on steroids. But the structure is different than you would think. What the structure is that the hospital becomes like the umbrella, and all the physicians and clinics become under them. And so they merge together into something called an accountable care organization. Then the federal government takes the money that they have at the federal level, and they give it to, let's just say, United Healthcare or Kaiser. And then Kaiser strips off 15% of it as administrative expenses, sends the rest of the money to the ACO, this hospital and physician group. And then the hospital and physician group, that's all they're going to get for a year for a certain population of patients. And now they have to divvy it out. What does that mean? That means that the health plan is no longer at risk for the health of the patients. It means that the ACO is at risk. And that means the doctors and the hospitals are at risk financially to care for the patients. And what does that mean? That means that the ACO, your hospital and your doctors, have become your insurance company.
Well, but what is the Aetna and Blue Cross Blue Shield doing now?
So what they're doing is they're becoming the dollar distributors and the patient trackers, because the ACO is getting money for a quote.
Why do we need them?
Because the ACO is getting this money for a population of patients, and they don't actually know who their population is, but it's whoever walks through their door. And they want to try and keep patients from walking through their door, because they only have one pot of money for this population.
Oh, yeah. So, they want as little patients as possible.
Right. And then if one of their patients for their population goes outside of the ACO, like to a different doctor or even to a different state, they have to pay money for that patient because they're in the population, right? So they have to know that that patient went somewhere out of the ACO, and that's what the health plans become. The health plans become all about the data, and they will. And so they're being paid for that data, but they're also, taking off this 15% that they're allowed by Obamacare to take for, quote, administrative expenses to provide to, the rest of, they're only allowed.
What would they be doing? I mean, the whole point is we're paying for insurance. So that's an actual product that we're paying for. But what are they doing now? That would be a non-product. I mean, it would be something we wouldn't want.
it's a different way of looking at it. That's right. You don't want your hospital and your doctors to become those who have a single pot of money out of which they're going to try and figure out how to divvy it from January to December. Who's going to walk through the door, pity you if you come in November.
Well, right? I just don't understand what these big companies, what used to be insurance companies, will be doing. I mean, like, what this administrative work, why would we need them? And why wouldn't the hospitals themselves be able to just pay for an outside service to manage that instead of having to do, I mean, I don't know what service they'd be providing other than huge overhead.
There has to be still the look of insurance. So you'll still have your United Healthcare policy.
But you know what I'm saying. I just don't. I just think it's a huge expense that's not actually providing benefits to people.
Well, it's not providing benefits to people, but I guess what the purpose for me bringing this up is for your audience to understand that we believe that the insurance company is not going to be doing insurance anymore. It's not going to bear any risk at all because it's going to shift that risk all onto your doctors and your hospital. And so your doctors and hospitals have a conflict of interest with you now because you're not paying them. They have been paid this pot of money. And this is where all of Obamacare is going, is to paying these pots of money, these limited pots of money that then the hospital and the doctors have to divvy out. It's unlike most people think about it because the structure of insurance has been here for such a long time that it's almost hard to put your mind around it.
Well, I just think that there's so many issues with that. Number one, what you're talking about, which is the fact that they don't even want their patient population to walk in the door. And so they're going to be incented to give as little care as possible. But number two, there's this whole huge overhead structure that doesn't provide any services. That is just a waste of money. So
in some ways, we already have that today.
Well, yes.
Today, right?
Yeah, we do. So I guess I'm just talking about that's a big waste of money in general.
Right. There's a lot of money being wasted in general just because of how we have set up this structure. Because the health plans don't really provide anything having to do with care, but they're raking in money hand over fistful as a result of the structure that has been set up, as a result of the fact that we have all moved to managed care, as a result of the fact that Congress decided that after they created Medicare, and there was essentially a run on the Treasury, that they had to do something. So back in 1973, they created the HMO Act. And the HMO Act merges the delivery and financing of healthcare together in a conflict with the patient. And then they forced all these companies across the country to offer the HMO so that they could build it up into a structure into which they could eventually move Medicare. And now, today, about 30% of people on Medicare are in Medicare Advantage, which is the HMO version of Medicare, which is therefore restricts where people can go and how much care that they can get.
So they also are tracking all our data. What will they be wanting all this data for? What would do you believe they're going to be using all this data?
The data is all particularly about controlling the physicians. So the data is used to profile both the patient and the doctor. And they come out with things like, quote, quality scores. But quality scores are really compliance scores. So they have treatment protocols that they put on the computers, which limit what doctors can do without going through a lot of hassle to try and get something that's, not on the list, right? And they use our data to say this is a standard of care that everybody should practice. Never mind that you and I and all your listeners are all different in very many different ways. We can have standards that are sort of general, to consider, but the fact of the matter is we're all unique, we're all individual, all the way down to our DNA. But our data can be used to create these standards, but they're not just guidelines. They're actually more like dictates or mandates.
See, this is a problem I'm having in general in how we're managing things. I teach at the University of Minnesota in the Carlson School, and there is a huge benefit when you have a fast food restaurant or if you have a assembly line, to have things very mechanized, to have things very laid out and exactly precise how you want to have things done. You can automate it. You can do all these things. But once you start talking about knowledge workers and where there has to be more creativity and there has to be more going on, you can't put people through that type of